We have heard from many small local medical practices, family medical practices here in Montgomery County that have experienced tremendous financial hardship through the pandemic. And we know how critical these primary care practices are to our public health infrastructure here in Montgomery County. There was a recent survey conducted by the Montgomery Medical Society that confirm more than 40% of local small medical practices are experiencing significant financial hardship to the point of consideration of closure. Many of these practices were not accepting new patients even before the pandemic. And if enough of them fail collectively, then it will significantly disrupt our public health infrastructure here in the county and also put us in a significantly weak position as we look at the possibility of an additional surge in the fall of COVID-19. So it's important, as we have with other essential operations in our county, that we support our medical practices so that they can continue to provide the high quality care that all of us so desperately need, especially now during the pandemic. And this particular $3 million is split up into three sections. The first will go to help support our primary care medical clinics that have contracts with the Department of Health and Human Services and serve many of the uninsured residents that we have here in our county and who have very disproportionately been impacted by COVID-19, specifically within 4 zip codes here in Montgomery County. The second tranche of funding would be a competitively bid process for both medical practices and dental practices to be able to access these resources to help shore up their financial situation so that they can remain solvent and strong and survive the economic hardship that they have been experiencing. And finally, the third tranche of funding is particularly exciting because we're calling it an innovation fund. I especially want to thank Dr. Travis Gales, our public health officer, and Dr. Crowell, who have been working with our medical community to expand in many ways our infrastructure, our public health infrastructure, and many of them through innovation are through telemedicine and other practices trying out new technology that as we come out of COVID will actually put us in a better position as a community. And so the third tranche of funding is to really acknowledge and help incentivize practices that are testing out innovation that will lead to improved public health. I also want to give a special thanks to District 18 Delegate Emily Shetty, who has worked closely with the council on the introduction of this special appropriation and has been working with local medical practices throughout, guiding them, helping them access federal funds and state funds. And finally, I especially want to thank all of my colleagues who are once again joining unanimously as a council to stand up this particular appropriation and support our medical community. So thank you all.